Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pathological conditions which are associated with the neoplasms. So let's look at some pathological conditions. So first one is the asbestosis. So asbestosis or the silicosis. So here the associated neoplasm, it includes the mesothelioma. So this mesothelioma as well as the lung carcinoma. So what is the etiological agent here? The agent is the asbestosis fibers as well as the silica particles. Next, we look at the inflammatory bowel syndrome. So the associated neoplasm is the colorectal syndrome, colorectal carcinoma. Next, let's look at the lichen sclerosis. So here in lichen sclerosis, the associated neoplasm is the vulvar squamous cell. It is a vulvar squamous cell. And when we look at the pancreas, so in pancreatitis, the associated neoplasm is the pancreatic carcinoma, and the etiological agent being alcoholism. So there is alcoholism, and there is a presence of germline mutation. Germline mutation. So example being the trypsinogen gene. So example is nothing but the trypsinogen gene. Next, we look at the chronic cholecystitis. So here in chronic cholecystitis, it affects the gallbladder. So there is the gallbladder carcinoma. There is a gallbladder cancer, and looking at some etiological agents, that it includes the bile acids. So there is presence of bile acids. There is bacteria as well as the gallbladder stones, GB stones. The next condition is we look at the reflux esophagitis. So and the Barrett's esophagus. This is associated with the esophageal carcinoma, and the etiological agent being the gastric acid. The next condition we are going to see is the Sjogren syndrome. The Sjogren syndrome. The Sjogren syndrome or the Hashimoto thyroiditis. So Hashimoto thyroiditis is HT. So here in Sjogren syndrome and Hashimoto thyroiditis, what is the cancer involved? Cancer involved is nothing but the malt lymphoma. So there is malt lymphoma. And the next is we look at the Opis thoracus cholangitis. Opis thoracus cholangitis. So here what is the condition involved? So the condition involved here is cholangiocarcinoma, as well as the colon carcinoma. So this is nothing but the carcinoma involved. And when you're looking at the etiological agent, it is nothing but the liver flukes. So it is the liver fluke or the Opis thoracus viverrini. So it is a Opis thoracus viverrini. Next we move on to the gastritis or the ulcers. So here in gastritis and ulcers, what is involved is the gastric adenocarcinoma, and the malt lymphoma. So what is the agent involved in gastritis and ulcer? It is the H. pylori. Then we move on to the hepatitis. So in terms of hepatitis, the organism involved is the hepatocellular carcinoma, and the agent here is the hepatitis B or the C virus. Next we move on to the osteomyelitis. So osteomyelitis, it involves a carcinoma in the draining sinuses. So the agent involved is nothing but the bacterial infections. Then we look at the chronic cervicitis. So it is involved with the cervical carcinoma, and the agent is the human papilloma virus. Next is the chronic cystitis. So here in chronic cystitis, what is involved? It is a bladder carcinoma which is involved, and looking at the etiological agent, it is the schistosomiasis. Etiological agent is the schistosomiasis. To learn and grow daily like this, please do subscribe.